Hello everyone. Today we are going to learn about asthma. My name is Mehul Makwana. So let's begin with the asthma. Introduction. Asthma is a non-communicable chronic lung disease characterized by the following features: airway inflammation. Second is airway, mainly due to muscle spasm associated with mucosal edema and mucus stagnation. The last one is airway hyperreactivity to aerobiological irritants. Causes of asthma. The first one is genetics. Some people are more prone to asthma due to their genes. The second one is sex. Males are more prone to have asthma, 2 1. However, the onset of wheezing is greater in females than males and asthma are more severe. Environmental factors. Exposure to allergens such as pollen, dust, and animal dander can trigger asthma symptoms. Lifestyle choices, smoking, and air pollution can also trigger asthma symptoms. And the last one is infections, predominantly viral in 40% of children. Incidences. The condition can occur at any age but is most common in children. Asthma is the most common pediatric chronic illness in the United States, affecting an estimated 6.2 million children under the age of 17. Children who have upper respiratory tract illnesses in early life are at increased risk of wheezing and asthma. Asthma results in 10 million lost school, 10 million lost work days. Deaths from asthma have increased by 31 since 1980. Incidents continued. Doctor agreed that asthma is indicated by chronicity and liability of the condition. There are times when breathing is challenging and noisy, and your chest feels tight. You may also cough up tenacious plague during these times. Early in the morning is frequently when symptoms are the worst. Let's look at the normal lung versus asthmatic lung. In the normal lung, you can see that the muscles are relaxed and the normal lining of the airways will be there and a normal amount of mucus. Whereas in asthmatic lung, you can see that the muscles are tightened and swollen linings will be there and excess mucus will be present. Let's see the difference between normal lung breathing versus asthmatic breathing. In normal breathing, airway enters through our nose or mouth. The air travels down the windpipe and trachea. Trachea separates into two tubes known as bronchial tubes. The bronchial tubes divide into smaller air channels called bronchioles. Each bronchioles ends in small air sacs called alveoli, which fill up with air every time we inhale. The air we breathe contains oxygen, which is then transported to the blood through the walls of the alveoli. Whereas in asthmatic breathing, breathing becomes difficult when something is bothering your airways. It is known as asthmatic attack. The small muscles that surround your airways contract tightly and enlarge, making breathing more difficult. More mucus will be produced by the lungs, and that as a result worsens the situation. Pathophysiology. The main pathological changes occur during an asthmatic attacks are spasm of the smooth muscles in the walls of the bronchi and bronchioles, edema of the mucous membrane, excessive mucus production, and mucus plugging. These changes result in airway obstruction. The chronic inflammation leads to structural changes, including smooth muscle hypertrophy. Once this occurs, there will be less chances to reverse the process compared to acute changes of asthma. Clinical symptoms. So in clinical symptoms, we can see that the can vary depending on the severity and frequency of the condition. In the adolescent population, common symptoms include shortness of breath, chest tightness, wheezing, and coughing, particularly during exercise or exposure to allergens. These symptoms may be worse at night or in the early morning and may be accumulate, accumulate difficulty speaking, sleeping, fatigue, or decreased exercise tolerance. Clinical symptoms continued. Doctors agreed that asthma is indicated by chronically or liability of the condition. There are times when breathing is challenging and noisy, and your chest feels tight. You may also cough up a tenacious phlegm during these times. Early in the morning is frequently when symptoms are the worst. Medical management. First of all, oxygen. Give oxygen to keep oxygen saturation greater than 95% in all children with asthma who are cynosed oxygen saturation less than 90% or who has difficulty in breathing while even talking and day-to-day activities. The second one is inhaler. Inhaler is one of the best management provided to asthmatic patients. It contains bronchodilators that relieves the symptoms and symptoms of bronchospasm. It directly take effects on affected area. It is vital that the correct inhaler type is prescribed for each patient's preference. Manually dexterity and maximal inspiration flow must be accounted, particularly at the extremes of age and disease severity. So the next one is environmental control also plays a major role in management of asthma. Avoiding the places that might trigger the asthmatic attack would be beneficial. Providing emotional support because the asthmatic patients suffer through a lot, so the emotional support will be nice. Positioning, proper breathing techniques and which position should be maintained while having attack should be educated to the patients. Dietary intakes. Research has been proved that there are certain type of food or diet intakes which could relieve the symptoms of and might reduce the incidence of attack. The research says that the correlation between increased prevalence of asthma and environmental exposures changes, particularly diet. The authors intended to establish specific dietary components that would be advantageous for those who have asthma and to show evidence in favor of using dietary interventions as a management method for the condition. The data for this research was taken from fourth Portuguese National Health Survey, which was conducted by the National Institute of Health and the National Institute of Statistics in between 2015 and 2016. A total of 32,644 adults participated in this study. Interviews were conducted in the household by trained staff interviewers, and the questionnaire included information and social and demographic characteristics, health and chronic diseases, including asthma. Trained staff interviewers conducted the interviews in the household, and the questionnaire included information on health and chronic diseases, including asthma. As a result, the authors found that out of five particular diet patterns, two diet patterns were associated with asthma. The high fat, sugar, and salt diet pattern was included, which includes pastry, pastry, chocolate, and sweet desserts, candies, salty snacks, alcoholic beverages, and consumption at snacks. The study suggests that the asthma patients might benefit from a diet abundant in fruits, vegetables, and fish while reducing processed and fast food intake. These findings have significant implication for managing and preventing asthma and highlight the potential advantages of dietary interventions for this group. The research also underlines the importance for further exploration in identify the specific dietary components that could be advantageous for individuals with asthma. So here are some references which I took for this presentation. Thank you.